Okay. Here's a greater need. Research shown that all therapies are roughly equally good. Okay? They do a lot of studies over the last 20, 30 years. They compare different approaches. They're about the same. Okay? They're about the same. Okay? The conclusion is that psychotherapy helps. Doesn't matter which modality. Okay? The number one. The second point is that there isn't anything called one size for all. Yeah? Simple education. In psychotherapy, also you don't have one size for all. So if you apply one approach to everybody, you'll be in trouble. If you only I think it's May or Maslow. I said maybe Maslow. They said if you only know how to use hammer, then you treat everybody else as a nail. Doesn't matter what your problem. Oh, you got a nail, boom, boom, right? But that's all you have, hammer. So the idea that they only use one approach is inadequate. The problem is that we're all wired for tribalism. Okay, we're all wired for tribalism. My approach is the best. My approach is the best. It's not the best. The tribal thinking, right? A better approach is that we need each other. Again, back to relationship. We need each other relationship so we can collaborate. So the latest finding is that pluralistic approach is the best. Pluralistic approach is that you're open-minded, you listen to the client about his need, about his preference, then you use the appropriate approach to help the person. So not just fix on one approach. So the future answer is pluralistic. That's what means therapy does. I'll show you later on. Means therapy is pluralistic and integrated around the key concept of meaning. The second thing is that we really need to develop grassroots mental health movement. Now, I'm an old man. I can't do everything myself. Okay. I'm trying. I'm trying to develop doing meetup. I have meetup in Toronto. Try to teach people in community of the basic practice, basic principles of living a meaningful life. And I also trying to hopefully help somebody, get somebody to get into school, teach students, the basic principles of living a meaningful life. So right now the narrative is that, when you have problems, let's fix them. The new approach is that prevention is better than cure. Let's start from children in high school, university, and community, and teach them if you live life meaningfully, know the basic coping skill, know what really matters. And then you will not develop more serious problems. So that's a new narrative, okay? Focus on prevention. Effective short-term therapy. So immunotherapy usually can be done in six sessions. I produce good results in 6 sessions because I don't waste time. I get right in. Get right in. Deal with the problem. Teach them a big business skill. Usually in 6 sessions. So that's very effective, right?